Hi, everyone. I'm Vic Sahakian. I'm the Chief Medical Officer of Pacific Fertility Center and Hatch, which is our in-house egg donation and surrogacy programs. Welcome to this conference. And today I'm going to talk for about 15 to 20 minutes about a very important topic, basic but an important topic, about what affects egg and sperm. And that will basically affect the outcome of a treatment cycle if you're going through IVF. I'm going to go through some basic information that'll give you the background to understanding that. First, about us, we've been in existence actually since 1992. We're a bunch of doctors who've been doing this for ages. I'm the Chief Medical Officer. I have 3 physician partners working with me, and our embryologist, Dr. Han, extensive experience with IVF. We have offices in Los Angeles. I personally have over 7,000 births. The program itself, we have over 14,000 births. We do, mostly I do egg donation and surrogacy, but the clinic itself, we do all sorts of infertility treatment, all facets of infertility treatments. Over the last 15 years, I've been specializing more into third-party parenting, which includes egg donation, surrogacy. The success rates of this field has changed over the last few years with the kind of advances in cryopreservation techniques and genetic testing. And we have now actually an in-house egg donor and surrogate agency. We've been associated with it for over 20 years. We have our own in-house egg donor agency, our own surrogate agency, and clearly we have an IVF center to provide care for anyone from all over the world. I have 50% of my clients come from outside the United States, a lot from Europe, China, and Australia. Certainly COVID affected that, but it's coming back, especially from Europe. The topic of discussion for me, for my part today for this conference, is a simple but important one. It's basically important factors that predict the success using egg and sperm to create embryos. By discussing these topics, you'll also understand what can you control with each one of these, the egg and the sperm. So the first thing I'm going to do, we're going to start with the eggs, and I'm going to give you kind of a background about the human ovary and how eggs are made. So when you look at the reproductive system in women, like men, they have 2 what we call gonads. It's called testicles in men, ovaries in women. These ovaries are inside the abdomen, and they basically are factories that make eggs. The difference between men and women is that the woman's factory has already made their eggs before birth. Men, our factories, make sperm continuously until death. Women's factories have already made their complement of eggs before birth, and there's no more new eggs created. So women are born with 1 million eggs at birth, right? And by the time they reach puberty, they've lost half of them. Still 500,000 eggs that they will use from puberty all the way through menopause. So that actually, you would think about it, it's ample amount of eggs to be able to have ample amount of kids. The problem is that every month in a reproductive cycle, in ovulation, there's a cycle that happens. It starts with recruitment. So basically, you have these ovaries who are filled with eggs, 500,000 eggs. At the beginning of each cycle, a bunch of these eggs, dozens and dozens of them, start growing. And it takes about 2 weeks. During these 2 weeks of these dozens and dozens of eggs, one becomes dominant, the rest die. The dominant egg is released, and that's ovulation. All the other eggs in that batch expire, they die, they're lost. That's very, very critical to understand that concept, because when you are an egg donor and you're producing eggs in a particular month, and you produce 20 to 25 eggs, those eggs you would have lost if we don't retrieve them. So I always say to an egg donor when she comes through cycle, I say, if you wanted to donate in March and I can get 30 eggs from you, and if you didn't donate that month, you would have lost those 30 eggs. So the amount of eggs actually we can recruit during an IVF cycle depends on many variables. One is age. The younger the woman, the more eggs I can get from her. The amount of drugs we give, and these are the same hormones that your body makes to recruit those follicles with just larger quantities. So the more hormones I give you, the more eggs I retrieve, except there's a ceiling. In genetics, not every 22-year-old will give you the same number of eggs. So when you're looking at the reproductive cycle in women, you realize that they're born with a set number of eggs. Every month, a bunch of these eggs are recruited. One of them is released, the others die. And as you get older, what's happening is the number of eggs you started with is dwindling. So you're losing eggs, and the quality of the eggs is deteriorating with time. So when you look at the graph of age and live baby rates per egg, you see that as a woman gets older, you see in this here, not only the number of eggs are declining, but also there's damage to the DNA, which means at the age of, let's say, 40, out of 10 eggs, one is normal. Meanwhile, at the age of 25, 5 or 6 out of 10 eggs are genetically normal and can become babies. So as you're aging, you're losing eggs and the quality is declining. And by the time you're 44, 45, realistically, you do not have any more viable eggs to become a human being. And that's a critical difference between men and women. We make sperm until death. There is some decline in quality with time, but overall, the difference is that we can actually produce more viable sperm at 80, while in women, by the time you're 45, 46, you've lost all viable eggs. So if we go back to discussing what can affect eggs, one thing you need to understand is there's nothing on this planet we can give a woman that will make a bad egg a good egg. And there are all these stuff you read on internet about CoQ10 and vitamins, probiotic, whatever, acupuncture, that promise to improve egg quality. Wrong. There's nothing proven that's available to us that will make someone have bad egg convert to good egg, unfortunately, okay? The only way you can fix egg quality is by getting an egg donor. So if you run out of eggs and you don't have good eggs, then the only way you can fix that is by getting young women to donate their eggs. So what are some of the factors that affect egg quality in women? Well, as from my discussion, you can immediately realize that age is the predominant factor that can affect egg quality, all right? The younger you are, the more eggs you have, the better your eggs, okay? Certain environmental factor can affect eggs, egg quality. Smoking, long-term smoking can affect your egg quality. Certain diseases, genetic diseases can affect that. Medications can affect that. But the message that I have to women always is the sooner you get pregnant, the sooner you try getting pregnant, the better odds you're going to get pregnant. So age will be the number one factor affecting egg quality. And you cannot reverse it. You cannot reverse time. There's no medications, nothing you can take will make your eggs better. Okay, so now quickly, I want to touch on frozen and fresh eggs, because this is something that's going to come up when you're in the process of doing IVF and you're looking to use an egg donor, for instance. And people ask, well, can we use frozen eggs or would we rather use fresh eggs? I'm sure you know that roughly 10 years ago, the cryopreservation techniques have improved tremendously, so that now with the process of vitrification, we can freeze eggs and successfully thaw them and recover them. Despite that fact, we still prefer fresh eggs versus frozen eggs. The reason being is, as good as we are in cryopreservation, we still lose eggs when we're freezing them and thawing them. And number two, fresh eggs fertilize better. And when you have embryos, you can test them so you know what you have. So whenever you freeze eggs, you're kind of in the dark. You don't know what you have until you thaw them, fertilize them, and make embryos. So now let's go and discuss the same thing with sperm, all right? So in men, there are the testicles. In women, there are the ovaries. The difference is testicles are factories that makes sperm continuously. Life cycle of sperm, 65 to 70 days. There's a new batch of sperm being made every 65 to 70 days. There are hundreds and hundreds of factories at the same time making sperm. So hence, we pretty much continue making sperm all the way to death. Although studies do show that quality of sperm does deteriorate with time. But unlike women, where by menopause 50 you have no eggs, you still can make sperm all the way in your late 70s, 80s, even though the quality declines. Now, when you look at the testicles and the way sperm is produced, it's a similar cycle as in women. The difference is after the sperm is produced, a batch of sperm is produced by one factory, okay, which takes 64, 65 days. You will lose that sperm eventually because the sperm will go and be deposited into the epididymis, which is this area here. And then if it's not ejaculated, eventually sperm will die. But continuously, there's replenishments of sperm. Even if men don't ejaculate and the sperm produced 3 months ago dies, you have new sperm coming. We produce 100 million per day. And every time a man ejaculates, it's 200 million sperm. Now remember, you need one sperm to have a baby. You need one egg to have a baby, right? In women, during an ovulation cycle, dozens of eggs are produced, very similar to ejaculation. So men ejaculates, millions of sperm are released. You need one sperm to have a baby. Women, during a cycle, dozens and dozens of eggs are produced. One is ovulated, the rest die. The difference, women, you run out of eggs by the time you're menopausal. You run out of good eggs. You know, in your 30s and early 40s, you've pretty much exhausted all good eggs. The good news is a normal egg at 40 is as normal as an 18-year-old egg. It's just you have less of them. In men, you will continue making a lot of sperm, good quality sperm. Even if the numbers dwindle, you have enough sperm usually to be able to conceive. The one important factor in men that many don't realize that as we age, certain genetic diseases are more common, like attention deficit disorders, schizophrenia, autism. So even though we have sperm, these conditions, the risk of this condition increases as men age. And over 50, the risk becomes significantly higher. So there's still a big advantage of having children at a younger age to prevent these preventable genetic diseases that we can't test for, unfortunately, but they're more common as men get older. So if you look at factors that affect sperm, same as in women, you can't make a bad sperm, good sperm. And there are many things that can affect sperm quality, such as smoking. Marijuana is one of them. So some recreational drugs affect the quality of sperm. Believe it or not, obesity affects sperm, trauma, overheating like jacuzzis and saunas. So there are some environmental factors that will affect sperm quality that if you stop, you can reverse it. We easily can test sperm and tell you if it's good or bad. And when you're doing in vitro fertilization, you don't need much sperm to create embryos. Unlike eggs, you need a bunch of eggs, you need good quality eggs. We can work with very poor sperm to create very good embryos. And want to go quickly about the in vitro fertilization process. to create embryos. I think it's important because most of you will probably resort to this type of treatment to have a baby. It's a simple process. It takes literally 2 weeks. You have an egg source, you have a sperm source. The egg source, let's say if it's a donor, will take fertility drugs. These are the same chemicals the brain produces to stimulate the production of an egg in normal women in their natural cycle, except we're giving the donor more than the normal quantity of these chemicals. They're in the form of fertility drugs, they're in the form of injections taken daily for about 10 to 12 days. What they do is simple. If you're not taking fertility drugs during your natural cycle, of the bunch of eggs that start the race at the beginning of the cycle and one ovulates, the rest die. If you're not taking any drugs and you have dozens and dozens of eggs starting this race, only one will reach maturity and will ovulate. Now imagine you're doing IVF and you're taking these fertility drugs. What you're trying to do is salvage or rescue some of those eggs that otherwise you would have lost that particular month. So the number of eggs I can rescue from an egg donor during an IVF cycle depends on her age. The younger she is, the more eggs I can rescue. Depends on genetics. As I said, not every 20-year-old will give you the same number of eggs. And depends on the amount of drugs I give you, except there's a ceiling above which I can't get more eggs. We thrive to get somewhere between 20 and 30 eggs. If you take tons of medication, doesn't mean you're going to get 100 eggs because there's a ceiling. This process of stimulating the ovaries takes about 2 weeks. We can do ultrasound to check the ovarian follicles which contain the eggs. And once the follicles are mature, so after roughly 10 to 12 days, we do a procedure called egg retrieval, where we go in with a needle into the follicles, aspirate the eggs, and then the eggs go to the IVF lab. The lab cleans the eggs. Now we have sperm already produced or frozen. We've thawed the sperm, we clean the sperm, and each egg usually is injected with a sperm or is incubated with a bunch of sperm. In conventional IVF, if the sperm is normal, using fresh sperm, we take a petri dish, we put these eggs in little wells. Each egg gets about 30,000 sperm to cause fertilization. If there's a sperm factor, or we're using frozen sperm, instead of putting thousands of eggs around sperm around an egg, we actually use a single sperm to inject it into the egg to cause fertilization. Over the next 5 to 7 days, we monitor the production of embryos. So an egg, if it's fertilized, becomes an embryo. It keeps growing. At a certain point, usually around the 5th day, you get an embryo that's called a blastocyst, multiple cells. Usually in our program, pretty much invariably, we do pre-implantation genetic testing, whereby we will biopsy the embryo and freeze it. The DNA material is sent for analysis, and basically we can, within a week, tell you the gender of that embryo. Not as important, but we can tell you if the embryo is affected with any genetic abnormalities that will lessen the chance of it sticking and increase the chance of a miscarriage. Process called pre-implantation genetic testing, PGTA, which we recommend and we do on almost every patient. So this is kind of in a nutshell, describing the egg, the sperm, and what can affect the quality of egg and sperm and how you create embryos. You will hear probably a lot about this processes during this conference. You can certainly email me with questions at any time. Again, welcome and good luck.